In the year 2010, Pakistan faced the worst floods in its living memory. Heavy rainfall and overflowing rivers devastated about 1/5 of the country. Over 20 million people were affected, many losing their homes, livestock and crops. An estimated 1,700 people died, and an alarming number were left requiring shelter, food and health services. The flood negatively affected the health of the population, in particular women and children, who were the most vulnerable to deadly waterborne diseases and in urgent need of healthcare. The Aga Khan University responded to this alarming national emergency situation by starting its own flood response program focusing on healthcare by sending 3 teams of doctors, nurses, paramedics and support staff to Khairpur Hospital, Sukhar Railway Hospital and Tata. The relief work was initiated by AKU with the use of its human and financial resources. Later, US aid support was sought and granted in the amount of $5.2 million for flood relief work. This grant was further augmented by another $1 million for nutritional assessment and intervention work in the flood-affected areas where AKU was working.
The Aga Khan University responded to the national floods of 2010 by contributing financially and later sending out volunteers to all the flood-affected areas that we could possibly go to. Our workers worked under very poor and adverse conditions. Following that, our help was coupled along with US aid's generous donation of $6.2 million. We have worked for over a year now, and we have seen more than 1.2 million patients, and the average cost to deliver this medical care to the patients has been just over $3 per patient.
With support from AKU Flood Relief Headquarters in Karachi, our people have been providing quality healthcare in 15 districts of Pakistan, spread across Sindh, southern Punjab, and even Balochistan. Over 420 professional staff with a diversity of experience have been working on the program, including more than 100 doctors.
The nursing staff, students and alumni of School of Nursing really worked hard during the flood disaster. They were also involved in the rehabilitation of flood victims. They worked in such remote areas in the open air camps where the temperature was 45 to 50 degrees at times, but they never stopped and continuously provided healthcare services.
At AKU, a number of departments have backstopped the efforts, contributing considerably to the success of the program. These behind-the-scene departments include pharmacy, safety and security, warehouse, purchase, human resources, finance, public affairs, transport and information technology. Since August 2010 to date, we have succeeded in providing quality medical assistance to more than 1 million patients treating a range of diseases. The most common diseases treated were diarrhea, pneumonia, skin diseases, malaria, conjunctivitis, and in the early days, snake bites and even dog bites. Mother and child health was already an issue in Pakistan, but the floods made the situation even worse. As such, AKU focused on providing healthcare to pregnant women and young children. the university made arrangements to send teams of pediatricians, gynecologists, family medicine doctors, and nurses to the affected areas. Many thousands of pregnant women in need of antenatal care and with anemia complications were provided medical assistance. Malnourished mothers and children were given nutritional assistance. Operating under difficult conditions, AKU teams ran outpatient clinics and emergency rooms, besides visiting flood-affected people living in makeshift shelters and camps. Many times, members of the team had to travel by boat to places where people were taking shelter. They worked in the open air, using charpoys and tables to examine people. Even now, some of our camps are located in such remote areas that our staff has to travel more than 70 to 80 kilometers a day to reach a site.
Children are coming here with malnutrition, severe malnutrition, moderate malnutrition. We are providing them supplements.
There are multi-complicated patients do come to us. At the same time, they have respiratory tract infection, along with that dehydration, skin diseases. So the condition in this area was very bad when we reached over here.
Most of the camps and centers were initially staffed by AKU volunteers who also contributed a day's salary to the relief efforts, a total of 7.9 million rupees. Currently, the relief work is being carried out by dedicated medical staff supported by administrative personnel. AKU's flood response program paid particular attention to community health education. Water, sanitation, and hygiene manuals in the local languages were used extensively to explain preventive healthcare to women, children, and men. The Aga Khan University continues to contribute its resources as part of national efforts by supporting the flood-affected population until they and health systems achieve some level of normalcy.
I would like to acknowledge all the frontline and behind-the-scene workers and leaders of the Aga Khan University and USAID who have given their valuable time, commitment, devotion, hard work for this huge humanitarian cause.